everybody. I had no idea that was going to happen, especially the Bavarian song, but I really liked hearing it. So thank you, everybody, and I'm glad everybody's together now. We're going to talk a little bit about celebrating advocacy here. So one of the first things that happen when you become, president-elect of this organization, people ask you two questions. You just want to know two things. What's your topic going to be? What are you going to talk about? What's going to be on the sign there? Your theme, right? And the second thing is, where is it going to be? It's the where is it going to be that I was really, really excited about, and there's a big reason for that. Because it was my first AANS meeting. And by the way, for you social media people, that's supposed to be hashtag my first AANS meeting, because I looked it up on Twitter. But anyway, let's move into that. I'm going to grab the clicker here. And then mesmerize you with what it looked like in 1979 when I first had my first meeting. That was only 44 years ago, right? I mean, the AANS, that's exactly what that front cover looked like. I had lost that cover in the move between being in Springfield, Illinois, and the Mayo Clinic. So when Spencer Bone, who works here, handed me that cover, it was an emotional piece for me, right? I remember exactly being in that meeting. And here's what I thought. Well, first of all, here's why I even went. I wanted to find out what motivates neurosurgeons to work beyond the daily patient care, the daily surgery that we do. I wanted to see what the most prestigious organization of neurosurgery had to say. I can't tell you how much excitement the exhibit hall was for me to see all these tools. Back in those days, you bought tools and took them home to your hospital and they would reimburse you. Those days are gone, unfortunately, but there's still a lot of excitement going on in that exhibit hall with new technology. But most importantly, what really got me into this organization was the fact that people were talking about mortalities and morbidities in the cases they were doing. And sometimes they even gave us case series on these types of complications. And it was a real honest discussion because the goal of that was an advocate goal, was to improve our skills, to get better, right? Donald Don was the first president of this was the president at the time of this meeting. What a great man. I just talked to him last weekend, gave him a call, checked out. I've called him a few times over the year. Gary's heard me, call. Hey, is that Donald Don on the phone again? Yes, it is. He's going to be 97 years old. No, he's going to be 98 in August. That's a legacy, isn't it? And when he gave his presidential address, he talked about how important it is for neurosurgeons, all of our neurosurgeons, to be cohesive and for us to work together and really have conversations about your own vocation and maybe even how you advocate. He sends his best wishes to all of us. So I really like Clarence Wattridge and his wife, Christy. They went out of their way to go back to Alabama to get a message from Dr. Donald Don that speaks to advocacy.
So he came up with this idea that instead of calling it the Harvey Cushing Society, it should be called the American Association of Neurological Surgeons, or at least that's what he vowed, that it should be one organization that speaks for neurosurgery.
It's made a big difference, hasn't it?
Oh, it's unbelievable. Well, of course, the organization and the meetings and everything and the activities, the involvement, the national office was formed about that time. But I think you become driven, hopefully mainly out of patient needs and what's best for the patient.
The other is the opportunity that it gives you the chance to change the life of people that previously nothing could be done for. And also to see and to help many times change the quality of that care that you're giving to these people to do even a better job.
So I really want to say a big thanks to Christy and Clarence for going out there and getting that footage, and to hear from a voice like that in the past. To me, I think that's just motivates me. So think about Cushing, for example. When I think about the AANS, you heard Ed Laws mention it was called the Cushing Society, right? Started in 1931. And the whole reason it was started was because he felt there should be an organization where you talk about your complications and how you're going to fix them and what innovation should come about. But he was an advocate on his own right. For example, Italy, Riva Roci. He said, you know what? This sphygmomanometer is amazing, especially the way it's been modified. We can now get decent systolic blood pressures. Let's still use them during surgery. And then he insisted on using a chart that showed the blood pressure, the heart rate, the breathing rate, and all of a sudden, things were improving where he was practicing. But he was famous for his copious knowledge of medical errors because he knew that that fueled advancement. And he also had documented his own shortcomings, which I hope all of you have done throughout your entire career, because that's how you learn. But most importantly, mortality was 50% with brain tumors when he started, and he dropped that to 13% during his career. So it's very meaningful. Okay, now we got to change everything and go to what today's all about, right? The pandemic challenge has changed the AANS and all of you in a most indelible fashion. So you imagine at a time where we find out, wow, we're going to have this pandemic, we didn't maybe take it too seriously at first, and then all of a sudden, wow, we're not operating. Oh, you can only bring cases that are serious emergencies to the operating room. So now all of a sudden we had a little bit more, kind of a different time on our hands. I mean, many of us were probably working in ICUs and ERs and kind of processing some of these patients through their COVID-19 disease. But there was also a little bit of time that we had off. And then during that time, simultaneously, was virtual meetings that were successful. All of a sudden we had Zoom, and we had all these products we could use to communicate. So what did that mean for the AANS? We really fashioned a board now that is a decision-making board, a board that knows on a day-to-day, has a working idea of what the AANS is doing. And we were meeting every 2 to 3 months, and sometimes on an as-needed basis. Same thing with our executive committee. But this then trickled down in a way to our other committees. So but at least what we've witnessed here in these last few years is a whole different kind of ethic in terms of working hard for this organization. And it was during this time, I think, that we really started engaging neurosurgeons at a new level. The other thing that we became proficient at is, like others have as well, but these virtual meetings really drove our education products here at the AANS. So what happened, though? We had to cancel meetings, right? So it started out, oh, cancel the Boston meeting. I remember it was so disappointing because I thought, oh, come on, COVID-19 will be over by then, right? No way. So then we thought, oh, I see Dr. Wilson out there. We're going to have our Vancouver, this is painful for him. We're going to have our Vancouver meeting. We're going to have it and then cancel. Oh, no, we'll move it, and canceled again. Well, then let's put it in Orlando, canceled again. Till finally, we had our virtual meeting. But this really understood the strength of this organization, the strength of the staff that backs us up, on a dime that was turned. And of course, Reg, I was worried about his meeting because I thought, God, there was a COVID infestation 2 months before in Philadelphia for his meeting, but somehow we just snuck that meeting in. But that takes strength and takes leaders. So I had people like Rich Byrne, who is battered about back and forth between which meeting he was the scientific program chair to, and Chris Shaffrey and John Wilson and Reg Haid really left a legacy of leadership during some very trying times. One of the things we identified during this is we thought, well, now we have a little bit more time. We got to really start thinking about our strategic planning. a big piece of that was, how do people vision the AANS? Because they, you know how it is where somebody sees too many acronyms and you think, what does that really mean? So when we talk about AANS, from now and into the future, it's always about an enterprise that is part of JNS, and it's our Neurosurgery Research and Education Foundation, and certainly Neuropoint Alliance. It's all part of us. And then we have a mission statement for which we live under. The American Association of Neurological Surgeons advances the specialty of neurological surgery through education, research, bingo, advocacy. It's the first time I saw that in a statement for this organization, which I thought was phenomenal. And look at the next piece, outcome science. That's going to be the new vector of understanding quality, a new dimension that you learned about earlier today. So you are an advocate. I think I'll start. I'll try one more time. Okay.
You are an advocate. Advocacy can be broadly defined as a professional imperative, and to many, it defines our soul and responsibilities to our patients and the public. We as neurosurgeons use advocacy to advance our specialty, assure public well-being, share our knowledge and experiences for the benefit of others, and provide safe and timely access to care to our patients. All of you as neurosurgeons here today are advocates. If you work on the home front, processing prior authorization for your patients, lead quality improvement projects, spend time at your local hospitals serving on committees to improve healthcare, or voluntarily participate in clinical data registries while encouraging others to join you, or give time for improving processes of patient care, then you are advocating for patient care. Or if you give thoughtful comments for peer review, or just give a patient or family the extra time and empathy it takes to fully explain a disease or procedure, or you dedicate time to reading scientific literature to help synthesize meaningful contributions that help establish clinical guidelines, then you are advocating for the education of peers and the public. If you have given your time and efforts as a mentor to help a freshly minted neurosurgeon just entering practice to learn the ropes of your hospital operating rooms, or even surgically assist that neurosurgeon when needed, you are advocating as a mentor. If you make a commitment to furthering education, research, and write scientific papers, or give your time to serve as a topic or section or chief editor, prepare educational materials to further the knowledge of neurosurgery, or perhaps give time to teach and give mentorship to medical students, residents, and early career neurosurgeons, if you prepare board examination questions or participate in oral board examinations, develop a program for continuous learning through the American Board of Neurological Surgeons, then you are advocating as a teacher amongst our brother and sisterhood. If you have participated in missionary work, trained international residents, helped initiate programs that address world health issues, or launched a virtual education program for a worldwide audience, then you are a global advocate. If you are an innovator, create novel tools and devices, discover new medicines and treatments, you are advocating for science that delivers the most advanced care to our neurosurgical patients. If you have given time and expertise to influence healthcare policy on the local, state, and federal level, build coalitions with outside organizations to expand influence, worked to give access to care, and stewarded new technologies with the regulatory administrations such as Medicare and the FDA to serve our patients, then you are an advocate. And today, this AANS meeting celebrates all of you who have been and will be our future advocates.
So as we focus on the future, we had to think about what we were going to do in strategic planning to make the organization better than what it was today. I reached out to Alex Valetka, who had gone through this at least during his presidency, and he partnered with Shelley Timmons on this. He said, oh yeah, that's a great idea. But you know, we're in a different time now. And so we decided to accelerate it, move it up a little bit because of COVID. You know, there were so many changes that were occurring outside our environment that we had to adapt to this. And this was also led then with Beth Sartor, who was the chief of our strategic planning here at the AANS. So during this time, of course, we talked about time to have these virtual meetings, and there was a demand now for in-person meetings, and we accomplished that in 2021. But this is also during a time that it was a time where we also felt like if there would just be a dip in the number of COVID virus infections, can't we just have an in-person meeting? People really get tired after virtual because we'd done many meetings virtually, many of us missing dinner, people getting served dinner pretty late in the night because of these meetings, right? But we went to Tucson, Arizona, which was a turning point in the advancement of our planning. And you can see here we had a lot of individuals that came and enjoyed themselves, and that camaraderie will always be instilled with me in today, that we still have to be in face-to-face as meetings like we are with each other. But at the same time, we ran through very intense asynchronous strategic planning meetings because we wanted to hear from everybody. This is strategic planning done by the top leadership. This is strategic planning that went deep into how people think and what is really the best thing for us to do in going forward. So then, out of this, we came up with 3 major mega issues we had to deal with. And the first had to do with diversity. And we were concerned. We looked at our neurosurgeons. Do our neurosurgeons look like the public that we're taking care of? Should we give it further thought? And so Aviva Bush was immediately identified as someone who could start this committee. This actually started out as a task force, but our board saw the importance of this, that they voted it in as a standing committee here at the AANS. But the thing about diversity, I just want to make this very clear. You know, diversity is only about perceptions. That's what it is. It's perceptions. The best part about perceptions is perceptions can change. Now that happens to be Hans. He was 4 years old at the time, and he had perceptions. And do you guys remember Paul Harvey? Anybody here? Paul Harvey? Right. So Paul Harvey in the 80s, the hospital stopped. The nurses would go running to get their lunch. It's the Paul Harvey radio show. He's a very famous radio host. And everybody wanted to listen to Paul Harvey. Well, you know, he had some things to talk about, and I thought perhaps this video would entertain you.
Politics, former President Ford says Congress is a disappointment. He says Congress doesn't get anything accomplished anymore. Oh, Mr. Ford also said once the United States elects a woman president, from then on, men are going to have trouble even getting nominated. But then there's fundamentalist Baptist preacher W.N. Upwell running for governor of Texas, and he says if he's elected, he's going to fire all female workers and, quote, send mama back home where she belongs, end quote, page 2. Oh, one thing more, in Bloomington, Normal, Illinois, both Dr. Skillrud and his wife are physicians. Both did residency at Mayo's. She is now in neurosurgery. Dr. David Skillrud is in pulmonary medicine. They have a son age 4. The son, Hensey, was asked what he wants to be when he grows up. He said he wanted to be a doctor like his dad. Why not a brain surgeon like his mother? No, the lad replied. The boy said, that's a girl's job. Paul Harvey. Good day.
So if it's perceptions, then we can fix it. And that's what the goal needs to be. And it's always going to be a goal. So the other piece that we found out was when we looked at our AANS structure, we realized we did not have enough young people in our standing committees. In fact, they were coming to our standing committees and they were like liaisons. What is that? They were reporting back and forth between young neurosurgeons and themselves. Reports. What do reports accomplish? So we had a very deep discussion about what we needed to disband, so to speak, young neurosurgeons. Of course, they'll always exist as young neurosurgeons, right? But to actually expand it. And part of the drive for that is, you guys, if you're going to spend this much time, 40 years in a career, your life is going to change, and it's going to change a lot faster than my life changed. You see, you just saw at least one major technology shown here that's probably going to change. And things are going to change all the time. But are we going to be able to keep up? We used to just be weekend warriors, to learn new tools, to find out how we're going to do our next operation. But we felt that these folks probably had a different need than maybe some of the older neurosurgeons had in terms of their career. And so we had 3 people lead this, Dr. Dornbus, Graffio, and Siva Kumar, and they've done an excellent job. So that's now called the E2M Committee. And of course, we're very proud of the work they have done. And then there's global relationships. And we have Jacques Marcos leading this. And that he's out there advocating for the further common interests of neurosurgeons and other worldwide organizations. But that also means what can we do in terms of the education realm and how we are going to start seeing these international people as more of a global people, because we're more global than we've ever been before. So celebrating advocacy as neurosurgeons, I wanted to make sure that our plenary had that going throughout the entire plenary. But I will have to tell you that the watching committee is the mother of advocacy. And you just look at the committee makeup. It's built by the AANS and the CNS, and then it folds into the watching committee, and then we're doing all these advocacy efforts. And you've seen this slide many times. We talk about our coding and reimbursement, our quality, AMA, et cetera, et cetera. But that is the mother of advocacy. But then you heard about Charlie Plant. What a guy, right? He has a lectureship that goes on into perpetuity. So this is not just a one-off here. This is something that's going to go in the future and celebrate his life and his commitment to the AANS. And then you heard about Al Roten. What a great talk. Al Roten and his enormous contributions to the field of surgical neuroanatomy, improving knowledge, safety to patients. That was his goal. That's an advocate. And then Alexa Kennedy, loved her story, just loved hearing it again. But she opened up doors for opportunities for surgeons regardless of their race, creed, or their gender. And she gave all patients access to care regardless of their means, and raised money through fundraising for those patients in need who were, financially disadvantaged. And then Troy Tippett, the Advocate Award. He was recognized now as our first Advocate Award winner, and I think as we go forward, we'll see some interesting award winners in the future. Then there's Beverly Walters, who just was on the stage here earlier. Tremendous giving on her time to teach us about how to read literature and determine what is real good literature and how we evaluate it. But the most important thing is she taught us so that we could teach others, better understanding how a randomized trial works. I mean, this is just phenomenal. She has a keen eye for evidence, and this will be passed on for many generations. And then Odette Harris, lecturing on Path to Advocacy. The Von Wegenen Fellowship is the absolute top award that any resident can ever get, at least in my mind. And I would think that I would have loved to have been a Von Wegenen Fellow, but it takes a certain expertise and a certain type of work to achieve that. And it was just an honor to see that Odette Harris is bringing international education to broaden knowledge to advance neurosurgical care, and we will be hearing more about that later. And then there's Fred Myers, my co-resident at Mayo. He has forged new concepts with all his colleagues at AANS how to advance our candidates and has a reasonable plan for meaningful continuous certification. I can't say enough about him. He's just a great guy, and we will be hearing from him as well. And then you heard about Dick Koenig, right? He's a general surgeon. I don't know if it was that obvious to all of you out there, but he is a member of the AANS, and he's done some great things in an international realm. But then I took journeys with others, right? An advocate's not someone that stands alone. It's somebody who works in teams with people. So I just wanted to acknowledge the Council of State Neurosurgical Societies. I grew up there. I have mentors there. I still have mentors there. People like Deb Enzel, Jim Bean, Clarence Wattridge, Troy Tippett, Mark Linsky, Michael Steinmetz, Josh Rosenow, and Joe Chang. That's just a small slice of how great that organization is and how they bring grassroots back to us as a national organization to better understand how we can improve healthcare in a broader manner. And then there's the AMA delegation and neurosurgery leadership. I know AMA, but you know, they are the biggest gorilla in the lobbyists, you know, in DC. So we gotta work with them to get and to instill with the AMA the importance of what we do as neurosurgeons so we don't get lost. And then it comes down to thanking the best. And this is how I think we should at least consider it. So we have Beth Sartor. It's going to be hard for me to say this. She was our chief strategy officer. She died the second month of my presidency. I wasn't sure how I'd live without her because she worked with me every day. I pestered her every day. She worked with me every day. I love her, I miss her, and it was very sad for me, but I wanted to thank her and memorialize that today. And then we have an incredible staff. And we had to change our staff a couple times because COVID really took a role in how our staff functioned and how we had to replace a couple people. But Kathleen Craig ran that ship and she knew how to do it. And we have a great sense of our entire staff, and that's what we're thanking them for. We are in good hands. And our neurosurgeons help drive us, the organization, because of this staff. John Ratliff, you guys, that's the best scientific program he has put together. With all these late-breaking abstracts, I cannot say enough good about him. Mark Krieger has been my speaker consultant. Linda Liao and Mark Spergsnyder, very instrumental in how we've chosen these venues and what we're doing here today. And finally, Katie Urico. She's got ongoing contributions that go on forever and into infinity, but she's helped us so much in governmental advocacy. She's brilliant, outstanding, skilled communicator, and you witnessed that earlier yesterday, but she knows how to engage neurosurgeons, and she knows how to engage coalitions that moves neurosurgery forward. So she is creating a better world for all of us and our patients, and that is important. Thank you all. You are all neurosurgeons that are advocates, and please enjoy this.